Welcome to Integrity Linguistics Institute. So let's listen to the audio now. Okay, so I'm going to play the audio now.
Now, we've all seen the stereotypical images of addicts hooked on recreational drugs, but addiction to painkillers like opioids has a much less familiar public face. From what I've seen, one reason for this is that the range of people affected makes them less easy to pigeonhole. I mean, there's no typical age, social class, and so on. And of course, most people seeking help for opioid overuse were initially prescribed the medication by their own doctors for pain relief. This highlights a major part of the problem. Physicians often pay little attention to the possible risk of addiction. They need to look carefully at patients' personal histories and assess the risk, considering things like depression and anxiety disorders, before prescribing opioids.
Okay, so that was the audio. So it's a slightly challenging question. So I will play the audio once more. Okay, just one more time I'll play and then I will give you the explanation. Right? So let's just rewind. Now let's hear the audio script. Okay, so I'm going to play the audio now.
Now, we've all seen the stereotypical images of addicts hooked on recreational drugs, but addiction to painkillers like opioids has a much less familiar public face. From what I've seen, one reason for this is that the range of people affected makes them less easy to pigeonhole. I mean, there's no typical age, social class, and so on. And of course, most people seeking help for opioid overuse were initially prescribed the medication by their own doctors for pain relief. This highlights a major part of the problem. Physicians often pay little attention to the possible risk of addiction. They need to look carefully at patients' personal histories and assess the risk, considering things like depression and anxiety disorders, before prescribing opioids.
Okay, so that was the audio script. All right, so what do you think is the answer? Is it answer option A, answer option B, or answer option C? Okay, so I'll give you like 5 seconds time to type your answer in the chat box. It doesn't matter if it answer goes right or answer goes wrong. Okay, so that is not at all an issue over here. All right. All right, so what is the 37th question asking us? All right, so here let's do the keyword analysis. In Dr. Madison's experience, so who is the main speaker over here? The main speaker over here is Dr. Madison, right? So Dr. Madison's experience, okay? So Dr. Madison is a neurologist, all right? So they have several years of experience, and based on that experience, okay? So from their personal experiences, okay, he's saying, okay, Dr. Madison, from their experience, he is telling one information. And what is that information about? Patients who become addicted to painkillers. So there are some people, especially in India, okay, say if you go outside India, it is extremely difficult to get medications, like, without a prescription, and even to get a prescription is extremely tough. So the medical system in India is actually very, very convenient. So just a small additional information, like most of the people who are addicted to painkillers are actually from India. Like, I read an article that the most favorite snack of Indians are Dolo. This is an information that I actually had read in a medical, like in some magazine or something long back. It's actually true, because Indians are like, they're for anything they take Dolo, whatever it is. So it is, it's becoming a little bit of an addiction. Okay, so here the Dr. Madison over here, who's a neurologist, this doctor is basically saying from his experience that there are some patients who become addicted to painkillers. That is, they cannot stop taking it for anything and everything they need it. And about them, the person is giving one information. Now, what information is that going to be? That is going to be their opinion, right? Their opinion shaped by their personal experience, right? So this is what you have to find out. Okay, Dr. Madison has an opinion about people who are addicted to painkillers, and this opinion was shaped by their personal experience. So when you are listening to the audio, you have to give very, very close observation to, this information. Everything else are basically distractors. Remember, the OET will always try to distract you. Right. So what is the stem of the question? What is the focal point of the question? Dr. Madison experience. Okay, patients who become addicted to painkillers. So over here, about these patients who are addicted. Okay, so we are going to talk about addicted people. So regarding addicted people, this person is giving us an opinion. So answer option A, answer option B, and answer option C. What are all these things? They are all opinions about the people who are addicted to painkillers, right? A, B, and C. So from A, B, and C, you have to find which opinion is the best. I mean, it is the Dr. Frank's opinion over here. Right. So let's take a look into answer option A. So what is answer option A telling? These addicted people, they are more likely to move on to hard drugs. Okay. So likely basically means what? Likely basically means possibility. Okay. That is these type of people. Okay. They are more likely. That is, they are more chances. Okay, more likely. So it is likely to rain today. Likely to rain today basically means what? There is a high chance that it will rain today. All three of you over here are likely to get grade A in your OET listening test, which means what? All three of you over here have a very high chance of getting grade A on your OET listening test. Okay, so here the opinion is this. They are telling these addicted people, that is, they are addicted to painkillers only, but from painkillers, they will move to hard drugs. Okay, that is from LKG, we move to UKG. From UKG, we move to first standard. From first standard to second standard. From second standard, we go to third standard, right? So that is from easy stage, we go to difficult stages in life. Okay, so like this, first stage number one, it is painkillers. First, they will get addicted to painkillers, and then they will get addicted to heroin. Then they will get addicted to cocaine. Then they will get addicted to MDMA, and more harder drugs. So this is the stage one. Okay, stage one is very, very innocent. That is painkillers. And then after some time, they will feel like, you know what? I need more stronger medications. I need more stronger medications. And then they will keep on moving. So this is the opinion. So Dr. Madison saying, in my life experience, people who usually become addicted to painkillers, they will never stop at painkillers. After some time, they want stronger medications. And then after some time, they will become addicted to even stronger medications. So this is the opinion number one. Now, what is opinion number two? Okay, opinion number two is this. They come from a wide variety of backgrounds. So here they are telling, that these patients over here, these patients, they are coming. Okay, they are coming from a wide variety of backgrounds. That is, they come from North Indian background, they come from South Indian background, they come from Chinese background, they come from rich people, they come from poor people, okay, they come from Africa, okay, they come from young people, they come from old people. Okay, now you see, these are the backgrounds over here. Okay, so sometimes when we think about addicted people, we think about, people who are like criminals. Like usually criminals are the people who are addicted to, these type of drugs, right? But the speaker is saying not only criminals, even people who look very innocent, okay, people who are having very responsible jobs, even from those backgrounds also, we get these type of addicted people. So the person is saying these people, they come from different backgrounds, not just one single background. It's a wide variety. Okay, a wide variety of backgrounds. That is option number two. So like this, you really have to comprehend the question, right? Next is answer option C. Patients usually have existing psychological problems. Now, see, there is a very, very big difference between these two words. So we have psychological and then we have physiological. So what is the meaning of psychological? Psychological is mental. Okay, mental problems. What is their mental health is affected? Physio. Physio basically means their physical body. Okay, their physical body is affected. Okay, so here psychological is different, physiological is different. So here psychological basically means they are purely talking only about their mental health. And now what is the keyword over here? They have existing mental problems. That is, people who are addicted to painkillers, they are mentally not normal. They are mentally abnormal people. They are not normal. They are abnormal. They have existing mental problems. And that is why they become addicted. Right. So we have three answer options over here. Now, what did we just do? So we did a lot of, highlighting, underlining and all that, right? So what we basically did is something called as comprehension of the question, right? What we just did is what we call as comprehension. Comprehension basically means what? Understanding the question. Right. So this is usually done using our keyword analysis. Right. Now, that is step number one. And that is why they give you 90 seconds time. Okay. There is a reason why they give you 90 seconds just to read 6 questions, because they want you to comprehend the information properly. So that is why you have to bring in your effective pre-listening skills. The next one is what we call as retention, right? So now once you have understood the question, you have to now retain that question to your memory. That is, you must not forget the question. Right? That is what we call as retention of the question. Retention basically means what? Registering that info into your memory, right? That is what we call as retention, right? And then finally comes detection. And what is detection over here? Detection is basically you selecting the correct answer, but it is not always very easy. So what should you do? You should refine your elimination strategy. Okay, so here you have to bring in your elimination strategy. And for that, there is a very tiny, tip I can give you. It is called as the verb analysis. Okay, the verb analysis. So that I will tell you. So what we did, okay, so we have right now comprehended the question, right? We have understood the question. That is, we understood the stem. So this is the question stem, right? What is the stem of the question? Patients who become too addicted. So opinion. So my duty is to find the opinion of this doctor about people who are addicted to painkillers. So we have comprehended that information. Right. So now you have to register. Now you must not forget what you understood. You must register that information to your memory. Right. So now let's do the verb analysis. Okay. So verb analysis is going to make the elimination strategy more easier. Now, what is a verb? Verb, see, these are all very important information I'm giving you. You will not be getting this type of, smart strategies anywhere else. So make notes of all these things. Verbs are basically action words, right? What are verbs? Verbs are basically action words. And these words are extremely, extremely important, especially when we're dealing with multiple choice questions. Now, what are the action words in answer option A? So in answer option A, what is the sentence telling us? This is an opinion, right? They are more likely to move on to hard drugs. So what is the action over here? Okay, what is the action in answer option A? Moving, right? So they are more likely to move on to hard drugs. So we can say moving on. So just imagine that is moving. That is, they don't settle down for just one thing over here. They keep moving on. So we can say moving on to hard drugs. Okay, so to get a little bit more clearer understanding, this is the verb over here. And this is the opinion, right? So this is the opinion that you have to find out. Right. Now, what is the answer option B? What is the verb in answer option B? Come from a wide variety of backgrounds. So what is the action over here? Coming. Okay. Coming from wide variety of backgrounds. So this is so you have to remember this, things. So from a different variety of backgrounds, these people are coming. So that is the opinion over here. Okay, so here they're talking about, in their opinion, these people, they come. Okay, so that is the action over here, right? They come from a huge variety of backgrounds. Now answer option C. What is the action over here? Usually have existing psychological problems. Okay, so here we can say having something. So what are they having? They are having existing psychological problems. Now that is the opinion over here. Now you see, now it is becoming a little bit more clearer, right? So answer option A, what is the opinion? They move to hard drugs. That is, they don't settle down from painkillers. From painkillers, they want heroin, then they want cocaine, then they want MDMA. Okay, they keep on going. So that is the action over here. Okay, they're moving on to hard drugs. Answer option B, what is the opinion? What is the action over here? They come. Okay, these people, these patients, they come from variety of backgrounds. Answer option C, having existing problems. Now you see, it is becoming a little bit more easier, right? It becomes a little bit more easier to register this information to your memory. Again, it takes some time. It takes some time to refine the skill, but I promise you, with commitment and consistent practice, it is possible. You just have to prepare very smartly, right? So like this, you have to like comprehend the question. You have to retain this information. Now, let's talk about how you have to retain this information to your memory. So this is extremely important. Now that you have understood the question, you know what your duty is, what the question, the stem of the question is. You have done the verb analysis and all that. Now what you need to do is you have to focus only on the answer options. So we have answer option A, B, C. So now you must not read the question. Now don't read the question. Now you should only look into the answer options. Now your eyesight. So I'm talking about your eyesight over here. So your eyesight should only be in answer option A, B, and C when the audio is playing. Okay, so during the audio, your eyesight, okay, I'm talking about your eyesight. Your eyesight should only be on the answer options. When the audio is playing, you should not read the question. If you read the question, that is when the audio is playing, okay, if you read the question, you are going to distract yourself. Remember that the OET is trying to distract you. Okay, so they are speaking of so much of information. They're talking about the correct answer, but they're also trying to distract you. Okay, they're doing their best. So minimum, you should avoid distracting yourself. So when the audio is playing, if you keep reading the question, then your eyesight is not on the answer options, then it is going to be a very big problem. So you must have a very strong memory of the question. So what is the question asking you? The question is asking you the opinion of this doctor regarding patients who become addicted to painkillers. Right. So when you're listening to the audio, your eyesight should only be here. Right. So now let's take a look into the audio script. Okay. So we have listened to the audio twice. So let's take a look into the audio script over here. All right. So let's take the audio script. All right. So now I'm going to give you like very practical tips on how your mind should work on the examination day. Right. So here we listen to the audio 2 times. Okay. So now let's read the audio script over here. So what is the audio script saying? So first of all, the person is introducing themselves, right? My name is Dr. Frank Madison. I am a neurologist, okay, with a special interest in overuse of painkillers, particularly opioids. Something experts are now calling as the silent epidemic. Okay, epidemic basically means a disease that is spreading fast. Okay, now see, there are different types of diseases. Okay, so what is a pandemic? Okay, so pandemic is extremely contagious. Pandemic is something that is extremely contagious. Epidemic, okay, epidemic is slowly but steadily spreading disease. That is what we call as an epidemic. So you really have to know certain terminologies over here. Okay. So here they're telling this is a silent epidemic, which means this is a health condition that is slowly spreading, but it is steadily spreading. That is, so for example, if we have a graph over here, okay, this condition is slowly, very slowly, but it is, increasing. That is what we call as an epidemic. So which means it is a very dangerous thing. Okay, so it's a very dangerous thing, that is overuse of painkillers. Right. So people think it is a very harmless thing to do because painkillers we can buy even without a prescription, but it is a very dangerous thing. Okay. But anyway, you must remember the question. What is the question asking you? Question is asking you people who become addicted to painkillers. So these are the key words you have to look into your, keep in your mind. Okay, so let's keep reading. Okay, so the person is saying, what is the person saying over here? Now, we have all seen the stereotypical images of addicts hooked on recreational drugs. So recreational basically means what? Drugs that we take for, just for ecstasy, we can say, just for ecstasy, euphoria, for happiness. Okay, so things that we do for happiness is what we call as recreational activities. Okay, so we have all seen stereotypical. Stereotypical basically means what? Typical. Now, these are all certain advanced words. Means we can say common. Okay, common or usual. Okay, images of addicts hooked on recreational drugs. So see, if you think of it, so if I'm asking you, all of you over here, think about a drug addict. Think about a drug addict. What is the image that is coming into your mind? You're thinking about a person who's having beard, mustache, who's not well dressed, okay, who is, looking very shabby. They are not clean, okay, they are, not taking care of themselves. So when you think about an addict, okay, a drug addict, so I'm asking you, imagine, okay, think about a drug addict. That is the type of, image that is coming into your mind. Okay, so that is what we call as a stereotypical image. That is a common or a usual image over here. Right. Now, the person is saying that we have all seen the stereotypical images of addicts hooked on recreational drugs. But, okay, so this is a contrast marker, but is a contrast marker. So Danesh is new over here. Okay, so yesterday's class, I talked about contrast marker. What is a contrast marker? Contrast marker is a word, and what does it do? It signals a sudden shift in idea or message, right? So this is what a contrast marker does. So the most common contrast marker is basically but. All right, contrast, green and red are contrast, colors. Black and white, they are contrasting colors. Contrast basically means opposite. Okay, so but over here is a contrast marker. Okay, so that means a opposite information is going to come. Okay, so here they're talking about usual images. Okay, usual images of addicts. Okay, now the word but is coming. So but is coming basically means it is a contrast marker, and this word is signaling a sudden shift in idea. Now see, now a completely opposite information is going to come. So let's read what that opposite information is. So now they are saying addiction to painkillers like opioids have much less familiar public face. Okay. So now see a completely different information is coming, a completely contrasting information is saying that is, people who are usually addicted to painkillers, okay, the reality is they are, they are not, they have a very less familiar public face, which means they are people whom you do not expect to be addicted. So just imagine, maybe a housewife, okay, a housewife who's well dressed, but that housewife is addicted to painkillers. So if I'm asking you to imagine a person who's addicted to drugs, so what is your first image that comes into your mind? A person with, as I told you, big, long hair, smoking a cigarette, okay, not dressed properly. That is a stereotypical image that is coming over here, right? But here, the speaker over here, the speaker is saying the reality is Okay, the reality is people who are usually addicted to painkillers, they have a less familiar public base, which means these are people that you do not expect to be addicted. So here they may be people who like very common people, like, housewives, or, business people, okay, like gentlemen, okay, who wear ties and shoes and suits. Okay, so even these type of people are also, in reality, these are the people who are addicted to painkillers. Now you see, a completely different information is coming. Okay, a completely different message is coming over here, and we were able to identify that because this but came. So that is the meaning of contrast marker. So in yesterday's class, I gave a small briefing regarding it. So here Danesh is new, so therefore I just repeated that information. But again, you must give importance to these type of words. So there are some other types of contrast markers such as although, right? Even though, however, okay, however, and but. So these are other types of contrast markers, and contrast markers signals a sudden shift in idea. All right, so you must know all these kind of things. Right. So now let's keep reading what this information is, right? So here, from what I have seen, now see, what is your duty here? Always remember what your duty is. Your duty is to identify the opinion. Okay, what are you trying to find? The opinion shaped by personal experience, right? This is what you are supposed to find. Okay, always remember the stem of the question. You are supposed to find what is the opinion of the person, and this opinion is shaped by the doctor's personal experience. Now you see, look at this word over here, what I have seen. So you are all nurses over here. Okay, so you will say, from my experience as a nurse, okay, people who are usually coming from this background, they are the easiest. People who usually come from that background, they are most difficult types of patients. Okay, so you are saying, like, so you're speaking from your own personal experiences, right? So when you listen to these type of words, so the speaker is saying, from what I have seen. So the person is speaking from their own personal experience. So we can say, now you have to become alert. Okay, now you have to become alert, and your mind should tell you, okay, now the person is talking from their personal experience, and now they're going to give us the opinion. And the opinion is about people who are addicted to painkillers. Okay, again, this is what we are supposed to find out. This is a keyword over here. Okay, so now let's see what is that opinion over here. So the person is saying one reason. Okay, so from what I have seen, one reason for this basically means addiction to painkillers, right? So you should know this basically means addiction to painkillers is that the range of people affected makes them less easy to pigeonhole. I mean, there is no typical age, no social class, and so on. Now, you see, over here, there is one very advanced vocabulary, and that vocabulary is basically pigeonhole, right? So I will just explain to you what is the meaning of this. Okay, pigeonhole is basically, so for example, in doors, okay, so if you have a main door, right? You have a main door in your house. So if someone is ringing the calling bell, in some doors, there will be a small hole. Have you seen? There will be a small hole in the door. And if you look into that small hole, you can see who is ringing the calling bell. Okay, so have you seen those kind of things? So that is what we call as a pigeonhole. Okay, so that small hole, okay, that small hole you see in doors or windows and all. So if you look into that, you can see who is there. Okay, so it's a tiny hole. So that thing is what we call as a pigeonhole. Okay, so here they are talking in figurative language, or it's a figurative speech. Okay, so I will have to take you, it's a different session. Okay, figurative speech, idioms, and metaphors. Okay, so that is a very, very different topic over here. That means there is no pigeonhole, but the person is expressing a message. Okay, the person is expressing one message using a phrase. Okay, which is not there in reality. Okay, so this is what the meaning of a figurative speech. So I'll take a different class on that. So there is actually no pigeonhole over here, but that person is trying to express a message using that particular phrase over here. Okay, so now see, let's see what that person is trying to tell us. Okay, so what do you understand from this? So let me just, you know, give importance to this. So the person is saying from what I have seen, okay, personal experience, right? So remember the opinion shaped by personal experience. So now you have to become alert. So what is the opinion over here? One reason for this, and what is this? This is basically addiction to painkillers like opioids. Okay, is that the range of people affected? Okay, so range. Okay, range basically means what? The extent of people affected. So people affected basically means what? Again, the people who are addicted. Okay, so they're talking about addicted people. Okay, makes them less easy to pigeonhole. Less easy to pigeonhole basically means what? Less easy to identify. Now you see, this is the message the person is trying to tell you. Okay, the person is trying to tell you, okay, there is a huge variety, there is a huge range of people who become affected. There is a huge range of people who become addicted to painkillers. And because of that, it is very, since, different types of people become affected, it is very difficult. Okay, that's what I'm saying. It is less easy. Less easy means what? It is very difficult. It is very difficult to identify who these addicted people are. So instead of saying, so here the person is trying to express this message. The person is expressing one message. What is that message over here? It is very difficult to identify people who are addicted to painkillers. And how is he expressing that message? He is trying to express that message using a phrase which is not there in reality. So there is no pigeonhole over here. Okay, it is just a phrase to express that message. So this is what we call as figurative speech, idioms, and metaphors. Right. So those who are not very much, aware on all these things, you can take it as a small assignment. Just take it as a small assignment. You can just go to Google and you can just ask yourself, what is the meaning of figurative speech? Because these are extremely common when it comes to OET. Otherwise, it was extremely challenging. Now over here, now the person is saying it is very difficult to identify these type of people. And now what is the person saying over here? There is no typical age. No typical age means what? Young people, middle-aged people, old people, different from all ages, from all types of ages, people are addicted to opioids. People are addicted to painkillers. Social class. Social class basically means what? The society in which they live in. Okay, whether they come from a rich society, whether they come from an educated society, whether they come from a poor society, whether they come from a, okay, that kind of, so different communities. Okay, the society over here. So here they're talking about there is no society as well. People come from different societies, different ages, and so on. Okay, now what is that information? Don't you think that is answer option B? See, what is the work, what is the keyword over here? Okay, they come from a wide variety of backgrounds. Okay, wide variety. And what is the action? What is the verb over here? They're coming. And who are these people? People who are addicted to painkillers. So from the audio, what do we understand? People from his experience. Now see, from what he has seen, from his experience, he's saying, okay, people who usually are addicted to painkillers, it is very difficult to identify them. It is very difficult to pigeonhole. It is very difficult to identify because they come from different variety of backgrounds. That is, they come from different social groups, societies, they come from different ages. So that is what they're talking about, answer option B. Okay, so now when you're listening to the audio, so as I told you, when you're listening to the audio, your eyesight should only be in the answer options. Your eyesight should only be in the answer options. So here your eyesight should be in answer option B. And why is your eyesight in answer option B? Because they're talking about wide variety of backgrounds, right? They are not talking about, see, is the person talking about psychological problems? No, the person is not talking about any psychological problems. Is the person talking about, moving on to hard drugs? No, the person is not talking about moving on to hard drugs. What's the person talking about? The backgrounds of the information. using synonyms over here. So your eyesight should be in answer option B. And you know, the keywords are repeated and also the verb is related and it is connected to the question. So what you can do, you can suspect, you can put a small question mark there because you highly suspect that B could be the correct answer. Right. So you can put we have not yet eliminated A and C, but you can say B could be the right answer. Right. So now let's take a look into the audio script over here once again. Where is the audio script? All right. Okay. And of course, most people seeking help for opioid overuse were initially prescribed, okay, initially prescribed the medication by their own doctors for pain relief. Okay. So now they're talking about, now see a different topic is coming. Okay. So here, what is the message over here? Most people, that is people who are seeking help for opioid overdose. So here, these are the people who are addicted to opioid overuse, but they want to overcome it. They want to stop their addiction. See, for example, if I am addicted to one drug and if I want to recover from it, then I will ask for help. Okay, if I'm addicted to one particular thing and if I want to recover, if I want to heal myself, then I will go and then I will go to a doctor and tell them, doctor, I am addicted to this drug, please help me. So here the writer is talking about people who go and seek help. That is, the people know they're addicted to painkillers, but they want to save themselves, they want to help themselves. Right now, here the writer is talking, the speaker, right? The speaker is talking about people who are addicted to opioid overuse. Now, what is the person saying? They were initially prescribed the medication by their own doctors. So, how did they become addicted? How did they become addicted to the medications over here? They did not become addicted naturally. They went to a doctor. Okay, they went to a doctor, and the doctor initially basically means what? The first phase. The first phase, right? So the doctor initially prescribed the medication and they liked it. Okay, so they started taking the so they were not addicted then. They went to a doctor. The doctor prescribed them. Initially, the first phase, the doctors prescribed the painkillers, and slowly they started liking the medication, right? And that is how they become addicted. Right. Now, why were the medication prescribed? Why did the doctors prescribe them? Because they wanted pain relief. Okay, they wanted pain relief. So that means they were experiencing pain in the body. And for that reason only, they were given painkillers. So what was the existing problem? So what was the existing problem? Existing means what? That already existed. That problem that existed was pain in the body. Right. It was a physical pain. The patients were suffering from physical pain in the body. And because of that pain in the body, they wanted pain relief. And that is why they went to doctors. So what is the existent problem over here? Physical pain. Physical pain was the, problem. But what is answer option C telling us? Answer option C is telling, okay, these people, they usually have existing psychological problems. Now, this is the problem over here. Psychological. Psychological means what? Mental, right? But if this is the word, physiological. So instead of psychological, if they're using the word physiological, then we can choose answer option C as the correct answer because they have existing physiological problems. But what is the audio telling us? The audio is telling us physiological problems only. But what is the answer option telling us? The answer option is telling that they have existing psychological problems. Mental problems is not mentioned. So because this word is not mentioned, that is mental health is not mentioned, we cannot choose answer option C. So we can eliminate answer option C. So C is eliminated. So like this, you should be able to eliminate one answer option. So this is how you have to bring in your elimination strategy, and you suspect that B could be the correct answer. So B is suspected to be the right answer. C you have eliminated because C they're talking about mental problems. But is the audio talking about mental problems? No. The audio is talking about physiological problems, right? Okay, so therefore it cannot be the right answer. Now here the speaker is saying this highlights a major part of the problem. Physicians often pay little attention to the possible risk of addiction. Okay, so why do doctors do it? Okay, doctors, they give very little attention to the possibility of addiction. Okay, that is, it is very easy for people to become addicted to painkillers, but the physicians, they are not giving it any attention. Okay, so that is the reason why anyone they come, they give them the prescription for painkillers. So now the person is saying, physicians, who's they over here? They basically means the physicians. They need to look carefully at patients' personal histories. So the speaker is saying, before prescribing painkillers, the doctors, they must look into the personal history, the personal background of the patients and assess the risk. Okay, and if the patient is a high risk for becoming an addict, then they should, not give them the painkillers, considering things like depression, anxiety disorders before prescribing opioids. So see, people who are usually depressed, okay, people who, this now see, this is mental problems. Now see, now they're talking about psychological problems. Now see, this is how the OET is very, very cunning, right? Now they're talking about depression, they're talking about anxiety, right? So what is that? That is basically psychological problems, right? So now they're talking about psychological problems, right? But over here, what is the answer option C telling? Answer option C is telling that people who usually become addicted to painkillers, they are what? They are usually people who have existing psychological problems. And these are the people who become addicted to painkillers. Now, you see, answer option C is very, very closely related to what the audio is telling us, right? But over here, the question is asking you, from this person's experience, patients who become addicted, become basically means what? Now, see, this is how much attention you have to give. Okay, become. Okay, say for example, a caterpillar becomes a butterfly, right? Then we can say um, tomatoes becomes tomato sauce. What? Okay, so what is the meaning of become over here? Become basically means it is 100% certain. 100% certain. Okay, so that is you will become. So for example, if I am saying you will become an OET success. So you will, okay. And if I'm telling like, student X became OET success. Become. What do you understand from that? You understand that it has 100% certain. That is 100% sure over here. Okay, so here the talking answer option C is telling. So you have to connect the question to the answer option. So question is asking people who become addicted, okay, they usually have existing psychological problems, right? But over here, what is answer option? What is the audio telling us? The audio is telling that these people are usually at risk, okay, and the audio is focusing more on the physicians. The audio is focusing more on the physicians, and they're telling physicians they need to look very carefully. Okay, they need to look carefully because they have a higher, because people with psychological problems, they are at a risk of developing addiction. That means it is not 100% certain, right? It is not 100% certain. That means, now do you think every single person with depression will become an addict? No, right? For example, I may be a depressed person, I may be an anxious person, but I will take painkillers, but I will not become addicted to it. So this is just a risk factor, right? So this is the reason why answer option C. So one reason why answer option C cannot be the correct answer is because the word in the question is become. So they are talking about 100% sure. But here it is just a risk factor. And not only that, here they're talking about physicians. Here they're telling, okay, physicians need to be very careful. But still the focus, okay, the focus is more on the initial problem. The initial problem is the doctors prescribing the pain. That is, for every single patient, the person is prescribing painkillers. Right. So here again the focus more on the thing over here. It is basically an advice to the physicians over here. So we can say that answer option C is partially correct. Okay, it is partially correct, but answer option B is actually more accurate over here because that is the opinion shaped by the speaker's opinion. Now, what is answer option A telling us? Answer option A is telling moving on to hard drugs. Okay, moving on to hard drugs. Now, is there anything mentioned regarding this hard drugs? Moving on, that is developing addiction to stronger opioids, stronger medications. It is not mentioned, right? So there is absolutely nothing mentioned related to this. So therefore, answer option A is the easiest to eliminate. Okay, harder drugs, moving on. Not a single keyword is repeated, not a single action word is repeated. So A should be the easiest for you to eliminate. Right. Now, what is answer option B telling us? They come. Okay. That is from this person's experience. The person is saying they come from a big variety of backgrounds. So is that mentioned over here? A huge variety of backgrounds. It is mentioned, right? Now see over here the signal words. So, okay, what are the signal words over here? The signal word is from what I have seen. Okay, so see, personal experience based opinion. So the person is saying from what I have seen. Okay, now they're talking about the range of people, that is the huge variety of people. Okay, it is very difficult to identify. And from his experience, they're talking about people with different backgrounds. There is no typical age, there is no social class, and so on. Okay, and of course, and then little bit I think more is mentioned over here. Yeah, okay, so that's it. Okay, so that is they're talking about the background information, right? So we can say B is completely mentioned. So you can suspect that answer option B could be the right answer. So A is eliminated and you suspect that B could be the right answer, right? And then when it comes to answer option C, now see, people who become addicted, they have existing psychological problems. Now see, this is actually correct. It is not entirely wrong. It is not entirely wrong, but comparing to answer option B, answer option C is less correct because over here, patients who become addicted. So here there is 100% certain. So will every patient who is depressed and anxious become this thing? And not only that, now you see over here in the audio, they talked about depression and anxiety, right? So here, these are very specific. Okay, depression and anxiety, what are they? They are very specific mental disorders, mental problems, right? But what about this word over here? So what is the word they have used over here? The word they have used over here is psychological problems. Psychological problems basically means what? Psychological problems basically means they can have depression, they can have anxiety, okay, they can have panic attacks, right? They can have phobias. There are different types of problems, right? Then what do you call like schizophrenia, okay, bipolar disorder, okay, like this there are different types of psychological problems, and everything comes under this one single word. But in the audio, they are not talking about every single psychological problem. There, they're talking about specifically depression and anxiety. So even though answer option C seems to be correct, seems to be correct. Do you think comparing to answer option B, which do you think is more correct over here? We can say the more correct answer option is answer option B because their variety of backgrounds. Now see, variety of backgrounds I have very clearly mentioned. What are they telling over here? Okay, no typical age, no social class, and so on. Now see, here they are very specific. Okay, that is they have huge variety of backgrounds and so on. So that is exactly what they're telling us. So here it is accurate. Okay, so the answer option is more accurate to answer option B. So comparing to B and comparing to C, we can say that answer option B is the more correct answer. So like this, so first you'll eliminate A and then you should eliminate C. So B is the right answer. So this is actually a very tricky question.